I'm Karina Bennett. I'm here at the Iowa House of Representatives with Iowa House Representative Janet Petersen. Janet is also on the board of Healthy Birth Day, a nonprofit dedicated to preventing stillbirths and infant deaths through education, advocacy, and parent support. Janet, hello.
Hi, thanks for coming.
Thank you. Can you please tell me about the legislation that you've passed here in the state of Iowa to help prevent stillbirths?
Sure. In 2004, we passed legislation creating the Iowa Stillbirth Surveillance Project. And what we do in Iowa, anytime a woman loses a baby to stillbirth causes, they collect information and data about the mother's health and also investigate what the potential causes may have been for the stillbirth and collect information that researchers can use down the road to help uncover some of the mysteries surrounding stillbirth.
And how will this help save lives?
Well, hopefully we'll have success with this, like the nation has had with the birth defects registry. That's how we were able to uncover that women need to take folic acid when they're pregnant to avoid spina bifida. We're hoping to unlock some kind of findings like that to determine ways that women can prevent stillbirth in the future.
Excellent. And why is it important to gather information about stillbirths?
Well, the one thing that I found after we lost our daughter was that there is just not a lot of research being done on stillbirth, and the medical community will say there's just not a lot of data for researchers to use. 26,000 babies die in the United States every year to stillbirth, yet it's not been investigated. There's very few research studies that have ever been done on stillbirth. We need to start collecting the data. So as they come up with ideas and hypotheses on what might prevent stillbirth, they need to be able to turn to data and have a pool of data to use. So in Iowa, we said we'll start here, we'll start collecting the data. Hopefully we'll have other states come on board and join us to build a bigger pool of data for researchers to use.
Fantastic. And what would you like to see happen on a national level?
Oh, there's so many things I'd like to see done on a national level. First, our country needs to have a conversation about the fact that we're not doing very well in healthy birth outcomes, especially compared to other countries. And there are so many things we could do to help reduce not only stillbirth, but miscarriages. We need a call to action from our members of Congress and the president saying, enough is enough, and we need to start looking into stillbirth and start researching it and to start educating parents on the risk factors and prevention methods that they can take to try and prevent losing a baby.
And Iowa's partnered with the CDC, hasn't it, for some research?
Iowa's Stillbirth Surveillance Project is funded in part from a grant from the CDC. We added Colorado, New York, and Hawaii to our project to get some different demographic groups to participate in the study. We would like to see the Stillbirth Surveillance Project done on a national level.
So there's a lot can be done to help women, and there's a great potential to drop the stillbirth rate by taking action, it sounds like.
There really is, and if I could tell women throughout the country one easy thing they could do to talk to a legislator, it would be to call their vital statistics department, find out how many stillbirths are happening in their state, which is data every state collects, the total number, and then also compare it to the live births, and talk to their legislators and talk to their members of Congress and encourage them to or ask them if they think those numbers are good enough or if they'd be willing to help in the cause.
That sounds good. So call Vital Statistics.
Vital Statistics.
All right, call Vital Statistics. Thank you, Janet.
Stillbirths can be prevented with your help. Visit www.counttthekicks.org to help save lives.